Ismat, it's Linda, right? Been here 25 years. You are 9 years old, right? Thank you very much for the contribution, right? Stay happy, stay well.
To this month, happy 9th anniversary. 讲讲九九
Happy 9 years anniversary.
Happy anniversary to this month.
Happy 9th anniversary this month. Yeah.
Happy anniversary to this month for being 9 years old today and many more to come.
Happy 9th anniversary this month.
Happy 9th anniversary to this month. Take care.
Happy anniversary this month.
Happy 9th anniversary this month.
Happy 9th anniversary this month. I hope there will be many more years to come.
Happy 9th anniversary to this month.
Happy 9th anniversary. Ismat, it's Linda, right? Been here 25 years. You are 9 years old, right? Thank you very much for the contribution, right? Stay happy, stay well.
To this month, happy 9th anniversary. 讲讲九九
Happy 9 years anniversary.
Happy anniversary to this month.
Happy 9th anniversary this month. Yeah.
Happy anniversary to this month for being 9 years old today and many more to come.
Happy 9th anniversary this month.
Happy 9th anniversary to this month. Take care.
Happy anniversary this month.
Happy 9th anniversary this month.
Happy 9th anniversary this month. I hope there will be many more years to come.
Happy 9th anniversary to this month.
Happy 9th anniversary. Ismat, it's Linda, right? Been here 25 years. You are 9 years old, right? Thank you very much for the contribution, right? Stay happy, stay well.
To this month, happy 9th anniversary. 讲讲九九
Happy 9 years anniversary.
Happy anniversary to this month.
Happy 9th anniversary this month. Yeah.
Happy anniversary to this month for being 9 years old today and many more to come.
Happy 9th anniversary this month.
Happy 9th anniversary to this month. Take care.
Happy anniversary this month.
Happy 9th anniversary this month.
Happy 9th anniversary this month. I hope there will be many more years to come.
Happy 9th anniversary to this month.
Happy 9th anniversary. Linda, right? Been here 25 years. You are 9 years old, right? Thank you very much for the contribution, right? Stay happy, stay well.
To this month, happy 9th anniversary. 讲讲九九
Happy 9 years anniversary.
Happy anniversary to this month. Happy 9th anniversary this month. Yeah.
Happy anniversary to this month for being 9 years old today and many more to come.
Happy 9th anniversary this month.
Happy 9th anniversary to this month. Take care.
Happy anniversary this month.
Happy 9th anniversary this month.
Happy 9th anniversary this month. I hope there will be many more years to come.
Happy 9th anniversary to this month.
Happy 9th anniversary.
It's Linda, right? Been here 25 years. You are 9 years old, right? Thank you very much for the contribution, right? Stay happy, stay well.
To this month, happy 9th anniversary. 讲讲九九
Happy 9 years anniversary.
Happy anniversary to this month. Happy 9th anniversary this month. Yeah.
Happy anniversary to this month for being 9 years old today and many more to come.
Happy anniversary this month.
Happy 9th anniversary to this month. Take care.
Happy anniversary this month.
Happy 9th anniversary to this month.
Happy 9th anniversary this month. I hope there will be many more years to come.
Happy 9th anniversary to this month.
Happy 9th anniversary.
It's Linda, right? Been here 25 years. You are 9 years old, right? Thank you very much for the contribution, right? Stay happy, stay well.
To this month, happy 9th anniversary. 讲讲九九
Happy 9 years anniversary.
Happy anniversary to this month. Happy 9th anniversary this month. Yeah.
Happy anniversary to this month for being 9 years old today and many more to come.
Happy 9th anniversary this month.
Happy 9th anniversary to this month. Take care.
Happy anniversary this month.
Happy 9th anniversary this month.
Happy 9th anniversary this month. I hope there will be many more years to come.
Happy 9th anniversary to this month.
Happy 9th anniversary.
Okay, testing 1, 2, 3. So guys, do let me know if you have any audio issues. Like if you can't hear me clearly, please let me know in the comments so I can adjust accordingly. We will be starting our webinar soon. I'm still waiting for my special guest. He's in the toilet now, so I'll be adding him in soon, very quickly. Hi, Diana. Hi, Muhammad Nizam. Hi, Churong. Hi, Sweeney. Thanks for tuning in. Hi, Sharon. So thumbs up means all is well, yeah? Thank you. Thank you, Muhammad Nizam. All right. So just to remind all of you, if you want to win treatment discount voucher, at the end of this session, we will be having a lucky draw event. So we will choose 3 lucky participants, and then we will give them a 30% treatment discount voucher. We will review on how you're going to do that shortly. Hello, Joey. Okay, so just now I've shown you guys the anniversary video of our center. So this year we are entering our 9th year. So it's an amazing feat, really. So I've been working in this company for more than 7 years as well. And throughout the years, of course, now I'm going to relate back to our topic a bit. This one center is actually a physio center and sports rehabilitation center specialized in musculoskeletal and sports injuries. Here we go. Our special guest is in now. I'm going to add him in.
Hello.
There.
Hello.
Hi. So this is Juan Shen. So he's a professional badminton player. So after I've done with my part, then I'll be sharing about what is his training over here at this Smart Center, and also what does he feel after doing the surgery and his experiences in his recovery progress.
Okay.
Welcome.
Now
Yeah.
live ready?
Now live ready, lor.
Oh, okay.
Okay, we'll be starting soon. So now we have 29 people.
Yeah.
Okay, so first I'll introduce myself first. So I graduated from Massa University, and also my course is actually BSc Horns, Northumbria, UK, and I'm currently the head of department in Damansara Sports Medicine and Rehab Therapy Center. So just now I'm mentioning halfway that this Smart Center is actually a center specialized in musculoskeletal and sports injuries. So throughout my working experience here, I've actually seen many patients with ACL injuries and also did ACL surgery. So we have gone through the rehabilitation with them and the back to sports progress with them, and then also help them in order for them to return to sports safely. Like currently, Jensen also is training for his competition in October, right?
Yes. Really,
Yeah.
really a lot of ACL patient. Your place.
Yeah, really, and a lot of badminton players also have ACL injuries, right? I think not only you think other amateur player or normal people who play badminton also they will injure their ACL easily So today our main topic is really about ACL Okay, so I have more than 7 years of experience in working in this Smart Center. And roughly I didn't really count exactly. I didn't really get the statistic, but definitely I've seen more than around 50 ACL patients at this Smart Center
This Smart operate how long already?
9 years already.
9 years. You 7 years there.
Yeah, 7 years there already So definitely got see different types of ACL patient already. Then so today I'll be sharing my knowledge and also experiences in treating ACL patient. And for our viewers here, if you have any question, just feel free to put up some comments, some questions in the comment section. I'm actually looking at the comments now. So if you want to ask me any questions later on, then I will actually direct the question to the slide here so we can answer the questions.
Yes, can ask any question because I feel I also quite because I gone through this lah, so I think I also can answer lah.
Yes. Or you want to ask Jensen about his badminton career, about how he coped with ACL injuries also, you can ask that later lah.
Yep.
Okay. So next, I would like to introduce all of you to our expert panel here. Showing my screen
Dr.
to
Gan. Hello, Dr. Gan.
Hi, how are you?
Good.
Welcome to our seminar, right? I think Joey is being modest. I think she's seen more than 100 of patients.
About there.
Right, thank you for joining.
So Dr. Gan later on also will be teaching us, or rather explaining to us about how ACL surgery is done. So we will be showing you all some interesting videos later on. Personally taken by Dr. Gan, the video is actually his actual video of him doing the surgery in the operation theater. So if you all want to know how Dr. Gan did his ACL surgery, then stay tuned to the end of the session. Then you will be able to see lah. Jensen, you don't know how ACL surgery is being done, right?
That day I saw, really, walao. I also didn't know my leg gone through this.
Yeah, gonna cucuk like this, gonna cucuk like that.
Oh.
Yeah, it's not very girly, but of course you can still see some blood lah during the surgery. So later, Dr. Gan will be explaining about the ACL surgery in details. So here just is a brief introduction of his career and of his experiences. So Dr. Gan is actually very well known. He has operated on numerous national athletes, not to mention the names lah, but there are a few national players who has been operated by Dr. Gan. And
right?
Yeah, and then he also very specialized in ACL reconstruction surgery alone. So he's also now the consultant orthopedic and sports medicine surgeon in Damansara Specialist Hospital.
Got people said I had done this surgery past 1 month. Now still on recovery period.
I see. How is your recovery period? Normally after 1 month is still basically quite new lah from the surgery consider. Later on, we'll be telling you actually what is the time frame of the ACL surgery rehabilitation. It can be up until months or year one, depending on your situation. So, Nizam, hopefully you are doing well with your recovery period.
Hopefully you are doing well lah.
Yeah.
Now I need to introduce myself, right? Because I saw my name is
here.
Is it?
Yes.
Okay. My name, I'm a professional badminton player. My name is Juan Shen. So currently playing for Malaysia as a professional player. My current partner is Sam. Yeah, so I will be going few Europe tournament this month 19, Denmark, France, and yeah. So I injured my ACL last year October, last October I think, and then I went for surgery. After that, actually when I injured my ACL I also didn't really want to accept that time because I went to few doctors, see if they want to operate can or not or what. But I think after I gone through all this I feel if your ACL is totally tear or what, I think straight away go for surgery is better lah. No need to wait. Yeah.
How do you injure yourself actually back then?
I think my knee gone like that inside.
You can feel your knee going like that.
Yeah. When I play badminton at the time, because I feel you injured or you don't injured, I think you also, if you want to play badminton or other any sports, I think you need to strengthen your leg or
yes,
your leg, you must have leg muscle lah. Not only when you are injured only you go for like training. Yeah.
If you know muscle, then you will get injured also. So,
yeah, because of MCO that time. Then didn't do any gym or what. Then after that, straight away go back to badminton. That's why I think that's the main reason lah.
Yeah. But luckily, you now come to D-Smart already for the
Yeah,
rehabilitation.
because I think ACL or not ACL, I think you also can go for training lah. Yeah, I mean.
Yeah. For athletes, we call this sports performance enhancement lah. So even though if you are not injured, definitely we can help the athletes to make them stronger. Especially for badminton, legs are very important. You need to lunge a lot. So definitely we can help you to improve your leg strength. Okay, so this comment here, Dr. Gan did my left knee several years ago. Not sure if but the rehab was so torrid and scary that I have put off my right knee until now. Not sure if I should have done it in the first place or they are just partial tests. Jared Ong, not quite sure what your question is, but you mean the rehab is too torturing for you, is it? Or you feel that the rehab process is very difficult? Can you clarify that later?
But I feel rehab is I think really important after ACL surgery. The main problem is rehab. I think you need to find a good rehab lah. So
definitely. Okay.
If you want to go back to sports and what, I think then go to D-Smart
Yeah lor. So this is actually the main topic for today lor. So after the ACL surgery, if you want to go back to sports, what are the things that you should be taking note? And also before we start today's session, actually we start already lah, but I mean before we go into the main topic, I'd like to tell the story of one of my clients. So he actually is an amateur badminton player lah. He likes to play badminton a lot. I think most of the Malaysians also like to play badminton a lot. So he tore his ACL when playing very intensive badminton and then went to do the surgery. Then after the surgery, he came to see me for the physiotherapy and rehab lor. But of course, like many other people, his job is quite busy lah. So he could not actually come for the physio and the rehab for many times. So I think he only come for the most 2 months. Then he disappeared already. I think he's too busy with his job.
2 months cannot.
And then he feels fine. Of course, he has no pain, no swelling, feels okay walking around, can run also. So I think after 6 months, he went back into badminton again. So very happy lah, go on court, play the badminton with his friends, then very kanchong like that. Then after when he tried to take one shuttlecock, that's it, tear again. The first surgery, tear again. Very bad. So the time we cannot accept, I did my first surgery. Now I tear it again. So how? Then of course go back to see doctor again. Then did another surgery. Then this time came back to see me again. And this time he very scared already lah, because he, of course, he doesn't want to tear his ACL for the third time again.
I got one friend England 5 times he tear his ACL.
Yes, I know one football player also tear his ACL 4 times, 3 times. So really have to take it very seriously lah. Especially I don't know. Yeah, here I think we have a couple of patients who have undergone ACL surgery. So this is actually also a reminder for you that the rehab part is really important. So you really don't want to risk yourself for another ACL tear again. So the story ended with the patient being very cautious, very aware. So he's now very committed to his physiotherapy and rehab. He learned his mistakes already, I would say. So actually the first time we also tell him physiotherapy and rehab is very important. But of course, when work is priority, the patient did not put rehab as his first priority lor. But now after having the second injury again, then now he realized actually it is very important. Time frame for rehab. Okay, this one we will talk about it later. Jiaming is the best trainer. Cool. Jiaming is our rehab trainer in D-Smart.
Very tired
yes. Okay, so I'll briefly go through what is our main agenda for today lah. First of all, I will explain to you all what is ACL and what can causes an injury to the ACL, and how important is the physiotherapy and rehabilitation after the ACL reconstruction surgery, and what is the criteria for return to sports. So you cannot just return to sports like that. There is a certain criteria that you need to meet one, like your SPM test, like your PMR test like that. If you want to work outside in the future, you need to pass your SPM first, something like that. So for
if you don't pass, you also cannot go university. Right?
Same thing. So if you don't pass, you still want to return to sports, then definitely there's a high chance of you re-injuring your ACL as well. So it's very important for you to do the testing first. So in this month, we actually have a very strict criteria for you to meet before you go back to sports. And also we will talk about the prevention of the second ACL injury, how to prevent it from happening. So this part is also very important, the prevention part. And then I will also be explaining about the importance of muscle strength testing. So just now, Juan Shen and I are talking about how important is to have very good muscle strength. So, but how do you know if your muscle strength is good enough? So here we actually do the test for the muscle strength as well. I think Juan Shen also did before.
Yeah, I did that day. Yeah. First day I went to this month. Yeah, I did.
So when you did the test at that, how is your muscle strength?
Not really good lah, because I think not really activate.
Yeah. So then after that, after the rehab, we will do another test again to see whether you have improved or not. So this is like an evaluation also.
I think everything in this month also quite what lah, quite semua pun ada lah.
Yeah, one-stop center. So we got to physio, rehab, testing, and also our doctor is also here to monitor what we do lah. So confirm very steady lah.
Yeah.
So next part will be about how to overcome the mental and physical challenges when going back to sports. I don't play competitive sports and I don't have a surgery done on my knee also. So definitely this part will be explained by Juan Shen lah. So he will be sharing his story a bit.
What?
So you'll be sharing your story later on.
I think firstly, I think mental come first. Mentally, because after I operated and everything, I didn't know whether I want to go back to sports or not. At first, and then I think mentally you need to be strong first. Physically you can train after like few months. After that you can train. That one is like just training. I think mentally is more important, because when you after your surgery, I think you see yourself, you cannot walk, you need to angkat itu tongkat semua. I think really suffer lah mentally, and then you cannot do anything, you only can sit down only, do physio, sit down. So I think mentally really quite mental quite important lah. So I think it will go through lah, need some time only lah.
Yeah, correct. And also definitely you will be facing some difficulties also during the recovery process, like pain, still got swelling, and then not fast enough.
So I think you must go to good physio center lah.
Yeah. So later on you'll be telling what you do in this month and how physiotherapy and rehabilitation helps you to get back to your fit level. Last but not least, Dr. Gan will also be explaining about the latest updates on ACL reconstruction surgery method. So of course, in the medicine field, things change quite a lot. So definitely the surgery method in 10 years ago and now will definitely be different already. So after that, we'll be showing you a video as well, and we will have a Q&A session. Okay.
That day I saw one video, I think not this one.
I think the surgery video, right? Yeah, because we uploaded in our Instagram as well.
Yeah, I saw.
Because we want the people to actually know about how it's being done. Okay, so the first thing first, what is an ACL injury? So ACL injury is a tear or sprain of the anterior cruciate ligament. So anterior cruciate ligament is the full name of this ligament. It's actually one of the main ligaments in your knee. So this one over here. So it connects your upper thigh bone to your lower leg bone. So very important for stability. So what happens in sports is the athletes or the people often tear their ACL ligament over here. So you can see in the first picture is a partial tear on it, means tak putus habis lagi lah, still there lah. But you see in the second picture, it's already fully torn already, putus habis already. So of course, usually this one more severe and usually requires surgery because you don't have your ACL anymore already.
Confirm require surgery or that one second one. But
yeah lah.
ACL very famous or why every time putus sure ACL one?
Why every time putus sure ACL? Maybe I get
normally lah.
Normally ACL is what we call the celebrated ligament. So every athletes, especially those requiring jumping, twisting, turning movement. So if you have an ACL that is that your exercise required to do this a lot, and then you're loading on it. So normally the ACL is a very strong ligament, many newtons before you can tear it. But a lot of this ACL, by right, is the nature of how you land and the nature whether your muscle go into play or not. ACL is a static stability, whereas your muscle has to come in as well. Without the muscles, you are not protected, right? So if you play any game, please have muscles and please have a good ACL.
Yeah.
Otherwise, you really have to build yourself up, right? And then weight is another issue as well. Fitness, weight, stability, muscles. Okay, we will explain further afterwards.
Okay.
If you hear one pop sound, confirm putus.
Most of our patients say, they'll hear the pop sound, then they know, sure, big thing already, sure, something serious. So basically, what Dr. Gan mean is why ACL surgery is so common over here, like at least in my center and in Malaysia also, because most of the people who play sports, either their muscle is not strong enough, or they are not fit enough, or they are also overweight lah. Then you can easily injure your ACL already. So these are the factors. And also, yeah, correct. So to further explain on ACL injury, we will be showing you how you can actually injure your ACL. So through twisting, pivoting, sudden deceleration, and landing from a jump also can cause you to tear your ACL one. So twisting is like that. So maybe
mine is twisting.
Yeah, probably. And also, let's say you have a very awkward jump lah. Like sometimes maybe you try to do a jump smash and then you didn't land properly, then you might tear your ACL ligament also. But normally it's the left leg lah. If you are right-hander, then normally the left leg land first when you jump.
Yeah.
Is the right or the left?
So your ACL surgery
left or the right
is on
side?
the left or right?
Right. Because I didn't jump, I just go to the side only. Yeah, just the backhand side. Yeah.
So you are a bit unlucky.
Yeah, really unlucky because that time didn't train for 3 months or so lah. Then went back to badminton straight. Yeah, I think muscle langsung tada. Terus main.
You must go to sports lab then and measure your muscle first before you go back.
Yeah.
So twisting, pivoting, sudden deceleration, and landing from a jump are the few things that can cause ACL tear. So as you can see from this picture here, this one I think is rugby. So if someone tackle you from the side also, it can cause your leg to twist and therefore tearing your ACL ligament also lah. So this is one of the example. But actually most of the time, the ACL tear occur in non-contact situation one. Means nobody tackle you, or nobody hit you or push you or something like that. It's your own problem. Either you didn't land properly or your muscle not strong enough to prevent the excessive movement, then your ACL will be gone already.
60 to 80%.
Yeah, occurs in non-contact situation. So most of the people will thought that, maybe people tackle me, then that's why I tear my ACL. Not really. So we can show you, this is actually our patient. I've gotten his consent. So he's a weightlifter. You can see he's quite big size. And then this is a video of him tearing his ACL actually.
In this video, Tear.
Yeah, on the spot he tear his ACL.
Wow, so ngam got video.
Wait, let me try to play the video. Not
I took 3
playing.
months after surgery to back to running. Yeah, lah. I think around 3 months can run already. If your physio is good lah.
Yeah, 3 months you are able to go back to running gradually.
Yeah. Slowly. I think ACL after you injured, don't rush. Man lay.
Okay, so I have problem playing this video, but never mind, we will go back to this video later lah. Actually, this video just shows how he actually buckle his knee when he lift his weight up. Then there is it. The ACL immediately torn on the spot already.
So ngam got video some more.
Yeah, got video, actually very interesting, but somehow cannot play now. We will play later lah.
Okay.
Okay, and what are the other injuries, or we call it associated injuries if you have ACL tear? So most of the time when you twist your knee or when you didn't land properly, you won't just tear your ACL. You will also tear your meniscus. You will also injure your cartilage. Also, you might be tearing your other ligament as well, such as your MCL, LCL, PCL, which we will not be going into detail today, but these are the other ligaments in the knee. In your knee, you are not just having the ACL ligament only, you also have other ligaments. So sometimes your injury is a whole package one. It's not just one injury on knee.
Satu set lah.
Yeah, full set most of the
I
time.
think my meniscus also tear.
Yeah, your meniscus also tear. Because normally twisting, if you injured your knee or if you tear your ACL with a twisting motion, then sure your meniscus also will kena lah. Because the meniscus is actually is a cushion in our knee, so it absorbs the impact. So when the twisting motion or the impact is too much, then your meniscus will also be injured.
Yeah.
So that's what happened in your knee lor. And the meniscus tear is actually the most common injury together with the ACL tear, with the percentage of as high as 40 to 70%. So it's almost, you can say that if you have an ACL tear for a certain percentage, you will have a meniscus tear also. Seldom I see a case with isolated ACL tear. Normally it's a combined injuries. Very seldom. I think I haven't seen one case with only ACL tear. Have you, doctor?
No.
No, doctor haven't even seen one patient with only ACL tear.
Sure ACL and then meniscus lah.
Yeah, most of the time lah. So what can be done for ACL injury? So if your injury is not severe, let's say if it's not a full tear or the tear is only like partial tear, maybe you can try for conservative treatment. Conservative treatment means that physio, just do physio only. Just strengthen the muscles around your knee so that you can still do your daily activities. But it depends lah. Let's say your goal is to go back to sports, but your ligament is not stable enough. Normally, the doctor will recommend surgery. So in the case, if you have torn your ACL fully, like the picture that I showed you previously, the ligament totally putus already, then usually surgery is the option lah. So as you can see, only option, yeah.
Because one of my friend also, he didn't want to go for surgery lah. Yeah. So he waited, and then after that also he did.
Because a lot of people didn't want to do surgery for some reason.
Yeah. Actually, I also didn't want to do surgery because I need time to recover ma. Yeah. Cannot play video.
I'm trying. I can play already.
Okay.
So this is a short video clip of how the surgery is being done. Just a small part of it only.
Actually, I came out from the surgery. I see my hole very small only. Then I thought, I think easy only. Then after that, I saw this video.
2 holes, 1 short scar. That's why you think like it's like a very simple surgery, but actually it's not lah.
But I think you must show them this video.
Now I can play this weightlifter video.
Pop.
One more time.
He landed wrongly, I think. Yeah, is it?
Yeah, probably, and also maybe the weight is too heavy, and then suddenly he's also very heavy. Not only the weight very heavy, this person also very heavy. So the weight plus his weight altogether, plus maybe there is some twisting motion in the knee, then there goes his ACL already.
Yeah.
One more time.
I think he landed wrongly, I think.
Yeah, the impact lah. And then also after this incident, he feels that his knee is very painful and then could not walk for some time. So usually this is what you feel like after you have torn your ACL ligament.
Yeah.
It will be quite difficult for you to walk quite some time. Unless the swelling subsides already, then probably you feel better a bit.
Yeah. But also longer lah after that.
Yeah, yes, you will feel like the knee is loose like that, like it's moving inside, something moving like that. So now to
I think you all must see just now that surgery video.
Yeah,
but later,
later we have the full version of the video, and then Dr. Gan will also be explaining. If not, you also don't know what you're seeing because it's too bloody already. So now, what is life after ACL surgery? Life after ACL surgery means a lot of physio, a lot of rehab, and also you need to be very committed in participating of the process as well lah. The necessity of ACL surgeries for partial tests, considering the rehab. Probably these questions I will direct to Dr. Gan, like in what cases?
Jared, I can't find your report, my report on you, so I'm trying to find out. But I think yours is the major. ACL has two bundles. Yours is the bundle that is the major one. So that's why when you have the injury, it's necessary to do the surgery, because yours, we are more concerned about you having arthritis in future. Right, so we want to do that so that when you are later, when you're older, when you are my age and all these things, you don't have to use tongkat and all these things, you see. Right, so not only going back to games again, so you have to understand that it's not just for game, but the primary reason for doing ACL is to prevent you from having arthritis and also allow you to go back to life again properly.
Yeah.
Right?
Yeah,
not all the time you feel longer only.
Yeah, especially if you are still young, and definitely you will be active for many more years, means you are still going to play sports. If your knee stability is compromised already, then like what Jensen said, you feel that the knee is longer, definitely surgery will be a better option for you to be able to stay active longer, maybe until 60 years old, so you can still run, you can still jog, things like that. Otherwise, maybe you are able to walk without the surgery, but you will be having arthritis at an earlier age. Like maybe at 30 years old, you will be having the feng sap already. In Chinese, we call feng sap. Feng sap. Arthritis lah, osteoarthritis. Jared, yeah, that was a main consideration. Old age living, haha. Okay. So I'm a physiotherapist. So my job is to actually help patients who underwent ACL reconstruction surgery to recover well, to minimize the complications during their recovery progress, like I would say. Because normally after the surgery, for sure you will be having a lot of issues. You will be having pain, you'll be having swelling, and then you also cannot bend your knee, you cannot straighten your knee, you can't even sleep well. You need to learn how to use a tongkat. So this is where we come in. We help the patient to go through all this, because normally after the surgery, patient feel quite helpless. That's why they are so scared to do the surgery. They don't know what they can do or what they can't do. So we will also be playing the role as an educator. Like, okay, maybe the first 4 weeks you need to use the tongkat first. And then after that, you need to do some exercise to maintain your basic muscle strength. And then you also need to do this exercise to maintain your range, to be able to bend your knee more and straighten your knee more. So our daily job is basically like this lah.
I think bending the knee painful.
Bending the knee very painful, yeah. And especially for Muslim patients also, because they will be doing the sembahyang pose.
Yeah.
to do the sembahyang ritual. So we also need to educate them on when can you go back to doing the full Japanese kneeling for your sembahyang as well. So usually depending on the situation, sometimes it's 4 months after the surgery, sometimes can be earlier, but sometimes need to be later. So this one is on individual basis one. And also for other people, you would like to squat a lot to do your thing, so that also cannot be done in the first phase lah. That one usually comes
Squat.
later.
Cannot.
Ah.
Cannot. Need to sit.
Ah,
Squat.
yeah. Yes, then we need to tell them, you need to do the thing with the sitting toilet lah. You cannot do the full deep squat. So education very important, and also our treatment also will normally help to improve the healing process so that your knee can actually recover faster. And then also we will able to help you to reduce the swelling in your knee, because normally after the surgery, swelling is the main issue also. I think normally the swelling, for your case, I'm not sure how long, but for our patient here, the swelling normally lasts up to 4 weeks lah, depending on the situation. Some can recover quite fast. Around there.
I think mine, because after my surgery lah, I didn't really can't really bend also, can't really straight, just like that hanging there. So I think swelling around 4 to 6 weeks lah, maybe. Yeah, every day.
Yeah.
Ice. My only friend, ice only. That
Yeah.
time.
Yes, because you feel better after doing the ice law. Your swelling will actually reduce. And then
Actually,
here
you
also
don't
we
put
have,
ice, I cannot really sleep. You put ice, actually the pain also not.
yeah, not so much. Then also you'll do other treatment also lor, like ultrasound or some electrotherapy to help to reduce the swelling. And then also we will give you some exercises to do to improve your muscle strength. So for the knee, the most important muscle is your quads, hamstring. Of course, the other muscles are very important as well lah. But normally in the first phase, we will put a lot of emphasis on the quadriceps muscle. And usually the exercise will start from simple and basic exercises, and then only we will progress to the advanced one.
Like leg raise and all that only, right?
Yeah, there are a lot of exercises which can be done. And then also you need to be careful lah. Certain exercises cannot be done initially, and some can only be done after a certain timeline. So this is what physio should know lor. Like a lot of people not sure what physiotherapy is and what is the difference of physiotherapist and chiropractor. So physiotherapist actually is well aware of these medical conditions and medical issues, and also we also follow a strict protocol of the ACL rehabilitation. So we will actually plan the program accordingly, according to the patient's condition, according to the patient's surgery as well. So nothing will go wrong during your recovery process. So it is also very important to improve your muscle balance lah, because sometimes you have imbalance issue in your knee. Like for example, your outer muscle is tighter than your inner muscle. Then that will create other problems as well, like maltracking of your kneecap. So maltracking of your kneecap means that your kneecap actually goes sideways.
I think mine a bit like that.
Yeah. So usually if you didn't do your exercises properly initially, then your inner muscle won't be able to develop properly, but your outer muscle will be hyperactive. You take over most of the work. So as you bend and straighten your knee will actually go sideways like that lah. So sometimes you can actually hear noises in your knee.
Yeah.
After the ACL surgery. So this is not the fault of the surgery, because sometimes the patient will be very scared of the noise. They'll say, oh, my knee is still clicking after the surgery. So is it because my surgery is not done properly, or is something wrong with my surgery? They will be quite worried about that lah. So actually, knee clicking is not really because of there's something wrong with the surgery. Sometimes it's because your muscle is not balanced. That's why your kneecap goes sideways. That's why you hear some clicking noise. So we have to make sure you don't have these issues lah after your surgery. So also depending on what, sorry?
Sure got sound.
Yeah.
Sure got noises.
Yeah.
Lah.
From Darren, I had this noise even without a injury. Oh. then probably you have some muscle imbalance issue, you can actually come to DSmart to get a consultation done.
Is this
It's
normal?
normal, depending. Sometimes it's just like air bubbles, and just like normal clicking noise. But if it's associated with pain, then definitely you need to look into it. And also what kind of noise is this? Sometimes it's just like maybe very light, 1 or 2 click like that. That one is all right. But sometimes the noises can be felt like grinding. It feels like your knee doesn't have any liquid inside, like no gel. Like my patient say, like my patient really like to say, whether my knee got gel or not, got enough gel or not. Is it no gel? That's why because my knee got sound, things like that. But sometimes because of the joint spaces. If the joint space is too narrow or the knee is in contact with the bone, then when you move your knee, sometimes there will be, we call it crepitus or grinding noise. Then you need to get some checkup done to see whether the grinding noise is coming because of the joint space issue.
Yeah.
And then if you didn't really bother it, eventually it will become a cartilage injury. And then after some time, your cartilage will become thinner and thinner. And then after that, you will have like very less cartilage already. Then you will get arthritis easily. Can gel it back.
Actually,
can
can
get
right? Can inject
The
something, right?
gel is a misnomer, right? So even if you do not build up your muscles, you put however much gel inside, there will still be sound. So still, it goes back to building your muscle properly, and you should not delay the treatment in terms of physiotherapy and strengthening, right? A lot of patients wait until there is loss of cartilage, then only come back. So that's a bit too late already. So that one, you're forcing people like me to go into your knee, visit your knee to do something about it. So I think it's better for you all to treat and see the physiotherapy first before you see me.
Yeah. Last option.
Yeah. Surgery and procedure is always the last option. If you can sort it out by physiotherapy, definitely is a good thing.
Yeah.
Okay, thank you, doctor. Okay, so last but not least, psychological evaluation. Like just now, Juan also mentioned that mental part is really important. So we also have to help the athletes in the mental challenge part. So we actually need to help them to build up the confidence towards their operated knee. So later on, we will mention how. So just now, actually, someone did ask a question about the time frame for rehab.
Yeah.
So I think this is related to that.
Yeah.
So a lot of people will ask when they see me, like how many months I need to go back to sports, like badminton, football, futsal, all these very popular sports. So sports actually are divided into 2 categories. So one is non-contact sports and the other one is contact sports. So what does this mean? Non-contact sports is the sports where physical contact is not involved. So no one will tackle you, no one will push you, no one will come and actually make you fall down like that. So non-contact sports includes badminton, tennis, bowling, ping pong, swimming. Those sports you do your own one lah. You don't have teammates one lah, basically. I got teammates, but no need to fight against each other like that.
No need to touch each other lah.
Yeah, no need to touch each other one. So for contact sports, it's like football, basketball, rugby, futsal. So there's a high chance of people tackling your leg, pushing you, like that. So contact sports actually, you need a longer time to go back, obviously because of the physical contact. So if your rehab is not done properly and straight away you go into contact sports, someone just push you like that, then you might re-injure.
Go and see Dr. Gan again.
I'll go and see Dr. Gan again. So that's the last thing you want lah. Like after successfully did the surgery, going some rehab, then after that you are back to square one again. So very sayang lah. Better not. So better follow the proper time frame. So also this time frame is different for everyone. different for everyone. It's, okay, here, although I mentioned you actually need only 6 months to go back to non-contact sports, that doesn't mean that you can really go back to badminton in 6 months' time. Also, you all must keep that in mind. It's very different for individual one. Individually, it's very different because you need to see how much is your muscle strength. So athletes normally can go back to their sports faster because they are fitter, because normally they got do training, they got do strengthening, they got do body conditioning. So normally their muscles are stronger than normal people. So that's why you see on TV, like for example, those international football players, they can actually go back to their football game within after 6 months after their surgery. But this is because they got do intensive exercises lah. So their muscle strength is not the same as normal people. So there are many things that you need to consider when you go back to sports. So you need to see what type of sports that you play, non-contact or contact sports. And then you also need to see how old are you. Age does play a main factor. Like if you are young, of course, faster lah. So if you are older, then of course it will take longer period of time lah. Because naturally, if you are older, your muscle strength needs more time to develop back. So age is also a factor. Gender is also another factor because female actually have a different structure with male, so their knees are actually more inwards usually. So if you have that problems as well, it might have a higher chance of re-injuring your ACL again. So means that you need to do more strengthening. For me personally, I think that if you are a female and then you are very active in sports, muscle strength is definitely very important to prevent you from getting knee pain or prevent injuries in your knee for ladies.
Strengthening, training, very important.
Yeah, I think we mentioned this for many times already. Strengthening is really very important. So although the textbook says that you can go back to sports within 1 year, but most of the time, many people will not achieve this level of rehabilitation within 2 years after surgery. So some people, even after the surgery, 2 years already, they're still not confident enough to go back to sports. Because maybe they didn't really do the proper rehabilitation because there are many factors budget-wise, time-wise. Like the story I mentioned just now, the patient was too busy with his work. He didn't really able to do the regular and proper physiotherapy. So a lot of factors come into play. So if we find that you are not suitable to go back to sports based on our test, or you don't feel confident enough to go back to sports, then it's better not to go back to sports abruptly lah. If not, you will just cause some injuries only. You cannot people ask you to play, then you just go and play like that. Then end up you will not have a happy ending lah. How about diet-wise? Yes, diet too do play a main factor in your recovery as well. I'm sure most of our patients here, they will actually take more protein during their recovery process because again, your main goal is to get back all your muscle strength and also to enhance your recovery. So for the diet-wise, you need to look into more nutritious foods, and also you probably need to increase your protein intake so that you can complement your muscle strengthening program. Otherwise, if you do not have enough protein intake, no matter how much exercise you do also, you're not able to actually gain more muscle mass because of that.
Yeah. But confirm.
Yeah. So next, return to sports criteria. So just now we talk about the PMR test, the SPM test, right? So in the Smart Center, the test that you need to do in order to pass the return to sports criteria is this. So you can see in this list. Yeah, quite a number of tests that you need to do actually to pass, to get A+ in order for you to go back to sports. So if you don't get A+, then means that, so sorry, maybe if you go back to sports, you are most likely to injure again.
A also cannot.
A, the best is to get A+, so that you are confident enough. You see the result, so you are confident enough.
Yes, no compromise for you. You are national athlete, A+.
Yeah. So of course, if your goal is just to walk normally, then probably you don't have to score very high on this law. If your goal is just to do hiking, or just like normal walking in the park, then of course, if you have different goals, then the different there will be different requirement also. Ideally, if you want to go back to sports, because here we are talking about return to sports, right? So definitely you need to pass all these things. So first, we talk about the timing. This one I mentioned just now already. There is a different timing for contact and non-contact sports. So you need to at least follow that. And then after that, timing also not enough. You need to see whether your muscle strength is good enough or not. So we will actually do this test for you. The myofeedback test, the dynamometer test, core stability test, and in-body test. So all these tests is to test your muscle strength, your core stability, because core is very important as well. If your core is not strong enough, there will be a lot of extra movement in your knee, which will also cause unnecessary injuries. And then for the in-body test, it will actually check whether you have sufficient muscle mass in your body or not, or whether your protein intake is enough or not. You can also see your body fat, is it too high? And then we also can see what is the distribution of your muscle in your body. Then we can advise you accordingly. And then next, hamstring to quadriceps muscle strength ratio. This is also very important. Hamstring to quadriceps muscle strength ratio, because if you tear your ACL and you did a surgery over your ACL ligament, means you rebuild your ACL ligament in your knee lah. Hamstring is very important to protect your ACL, your new ACL.
Hamstring.
So hamstring, yes. If you have very strong hamstring, you won't be straining your ACL ligament. Later, I have a picture to show you how does hamstrings help. So if your hamstring is strong enough, then the chance of you injuring your ACL ligament again is very, very less. So that's why you can see some of the football player, international football player, after doing the ACL reconstruction surgery, they do a lot of hamstring exercises, like Nordic curls.
I also do a lot.
Good. Like Nordic curls, that one really hard. Nordic curls, and then leg curls, any exercise just to strengthen your hamstring. Very important. And then the next test we call the ALISA test. So ALISA test is an advanced lower extremity sports assessment test. So through this test, we can actually see your left leg and right leg, whether the difference is it too much or not. Because we actually want the difference to be less than 50% only. So if your left leg can jump this far, but your injured leg can only jump this far only, means difference is too much, then we will fail you. Means that your injured leg has not achieved the optimal strength or condition that we want. So we will do all these tests for the patient, and then at the end, we will have a report that states that whether you are suitable to go back to sports or not. Clearly stated there, it's just pass or fail only. It's as simple as that. Jared Ong, eat more red meat.
Get gout after that.
Red meat.
You're going to get gout. So not only ACL, so knee has other problems as well. So if you too much red meat, maybe not a good idea. So vary your protein. So take fish as well. Take other things as well. All right. So don't only take red meat, right? I know it's good. Now you pair it with wine, even better.
You ask me to eat more. Yes, you need to eat more, but you need to eat a variety of food lah. You can't just focus on one. You need to have a very balanced diet.
Campur lah.
Campur lah. All kinds of protein is good. And lastly is psychological readiness. Again, mentally, you need to be very strong as well if you want to return to sports. You cannot be thinking of, I'm scared that I will injure my knee in the same way again. You cannot always have that in your mind. You need to get it out of that. You need to be very confident in your knee after the surgery. So this is a thing that we want to help our athletes or our patients to achieve that.
Yeah, I think for me, if you go for training, go for rehab, I think you will have confidence lah. Yeah. If you don't go, if you go for rehab, you also will think, oh, I did well in my rehab, so I think more confident lah. Yeah.
Like for example, if you have never jumped before, then suddenly you want to go out there and do jumping, for sure you won't be confident enough lah. So definitely you have to practice first. And then how to practice. So this is a 3-phase model that allows graded progression recommended by the World Congress in Sports Physiotherapy. So basically what is stated here is that if you want to go back to sports, you need to separate it into 3 phases lah. First, you need to return to participation first. So what is return to participation means? Means that you need to participate in your rehabilitation and training lor. So for example, like for Juan Shen is a badminton player, you will definitely let him do some lunges first. Because lunges is very important in badminton. You need to lunge to the left, lunge to the right, and lunge to the back sometimes. So we will let you try first. But at a low level, gradually build up the confidence, not just straight away ask you to lunge 1,000 times like that, then your knee koyak already lah. So slowly introduce the exercise that is related to your sports. And there before injury, smash 299 kilometer per hour. After recover, now smash 599 kilometer per hour.
You come and see me. You make it touch 600.
Why 599? Why not 600? Wow, if it really happens, wow, steady looking. But sometimes it does happen, like because some of the patients, they never really do exercise before their surgery, but after their surgery, they are so committed in doing the exercise, they actually feel stronger. They actually feel like they can run faster, they can jump better. So this is the power of exercising properly with the correct guidance. Another question here, any modalities is helpful for the ACL healing recovery? Yes, there are a lot of modalities that we use here. We use ultrasound to reduce the swelling and the inflammation. We also use the electrotherapy to stimulate your muscle, because initially your muscle will be like not waking up like that, like it's sleeping for a long time. So it will be very hard to activate your muscle. So we will use some current to stimulate your muscle. So it's definitely faster to recover if that happens. Yeah.
Yeah, you can go this smart. If you do at home, you also can't do all this, right? Because I think ultrasound and what not cheap lah, quite expensive for the equipment, right?
Yeah, definitely. Yeah, Siting mentioned ultrasound. Yeah, correct, ultrasound. And also during the exercise session, we will give you some weights, some resistance band for you to gradually build up your muscle strength. So there are a lot of equipments involved. And of course, the hand of the therapist is very important also. Yeah, our magic hands. We will do some stretching, some manual skills, some mobilization, some massage in order to help you feel better. That one cannot be replaced by the machines lah. You know, the hands of the physiotherapy. Like laser, yes, laser definitely helps in scar tissue. So although the scar is very minimal in ACL surgery, still you will have scar tissue. Then sometimes it will give you some pain and affect your movement as well. So yeah, laser definitely will be done as well if the patient requires it. Killer hands that make you cry. Yeah.
Yeah, come on, you are stronger than that, Jared.
Luckily, under my hands, not many patients cry lah, but definitely they do scream and yell sometimes. So that one is a very, sure scream.
When bending that time, yeah.
But don't take it wrongly. It's not like it's very, very torturing. This is actually a good pain that you need to undergo in your recovery progress. No pain, no gain, right?
You will feel good after bending. Yeah.
Oh, you will walk out like you can fly like that, definitely. So just now I mentioned halfway that you need to participate first to get the feeling of like you're getting back to the sports, but not really going back to the sports first. Then after that, only you will start to go back to your own sport, your specific sport, but only at a normal skill level. Means you're not going to do very competitive game or very aggressive one. So you need to adjust your level of playing. So what return to sport here means that you need to give yourself some time to get used to the loading of the sports. But you must make sure you don't go too far. And then the third one is to return to performance. So now in this third phase, you will be participating in your sports and performing above or at your pre-injury level. So this is the final phase that we would want our patient to achieve, to be able to go back to the highest performance. For example, go back to competition, or go back to like last time, go back to your usual level of playing. So definitely we have to separate the phases into these 3 phases. You cannot straight away hantam and then go back to your usual level of playing, because you need time to build up your confidence.
Need time.
Need time one, definitely need time one. Just like after the surgery, you need some time for the structure to heal. So there's no shortcut towards this. So there's a quote here: building up confidence towards the operated knee and relearning skills is essential for successful return to sports. You also need to learn back some skills, like sometimes certain movement you didn't do for a long time already, then suddenly you need to do that movement again. You also will feel quite not used to it.
Yeah. Like I did running, then first time I run, that time I also need some time because few months I didn't run.
Yeah, so maybe at first when you run that time, you have some limping. Or you cannot run too fast like that. Then you need some time to reduce the limping, get back the strength, then only you can run like before. So we have another question here. For those with partial ACL tear, which particular exercises are important to help avoid or delay the surgery?
Amy, do you have instability? If you do not have instability, you don't have to do any particular exercise. Any general knee exercise will help you, but you definitely have to look into your hamstring. If you have symptoms, that means you have instability, like what Johnson said just now, you feel that your knee is giving way, then you definitely will need surgery. Okay?
Yeah, definitely hamstring will be important. Let's say if you really want to avoid surgery, or due to some circumstances you can't do surgery now. For example, maybe you are in overseas and you want to do surgery there. So you can actually prevent further injury or further damage to your knee by strengthening all the muscles around the knee, but you pay extra attention to the hamstring because you already tear half of your ACL. So you need the extra support for your hamstrings to give you a stable knee. So please do focus on your hamstring muscles. And of course, other muscles are equally important as well. So hope this answers your questions.
This is our sports.
Yeah, so if you are not sure whether your hamstring is strong enough, definitely you can come and do some sports testing over here to see what kind of muscle strength that you are having right now, whether is it strong enough, good enough or not. So here's a fun fact. I will not say it's fun, it's actually quite a scary fact. Actually, 25% of the athletes suffer from repeated ACL tear.
That means tear again after surgery also.
Yeah, so 1/4, that's actually quite a high number. 1/4 of the athletes tear their ACL for the second time. And 55% of those who suffer initial ACL tear never return to their previous level of play. So more than half of the people who do surgery already, they still cannot go back to their usual level of play. Due to a lot of issues. Why do they have all these issues? Because they didn't meet the return to sports criteria. They didn't do proper physio and rehab. They didn't do proper strengthening. They also didn't allow some time for them to participate in the sports gradually to build up the confidence. So a lot of issues are causing them to stop, to fail to return to sports. So even now also, even though now with the education level of most of the people here, most of the people know that, after the surgery I need to do physio. But like I say, some people just cannot be able to spend some time in focusing on their physio and rehab. So that's why their recovery got delayed.
Yeah. I think at least 1 week once if after surgery, at least
Yeah, at least definitely after surgery you need to be more regular a bit. 3 times, 4 times, or even daily is also fine. Then after that, once you are better already, then only you can gradually cut down your sessions. And then you can do some exercises at home to complement that. So what is missing out? Why a lot of people cannot go back to their sports? Why a lot of people tear their ACL again? So this is the thing that we are going to discuss now. And actually, what is the main thing for you to focus on to return to sports safely? We are going to emphasize on this as well. So this is a chart of what will happen if you play sports lah, basically. So normally if you play sport, for sure something will happen lah, especially in contact sports. Somebody will push you, or you will have a very funny landing if you jump, like you will land, you have a very stiff landing. Your knee control is very poor, that's why you land directly on the ground like that. And then all these things will actually cause you to injure your ACL again. So a lot of unanticipated events can happen in sports. So also if you do not do your rehab properly, if you have knee weakness, if you have hip weakness, you have poor postural stability, or you have dynamic valgus in your knee, which I will explain later, or you are quite stressed. Stress can be a factor also. If you keep on thinking, very stressed, I don't think I can play this game because my knee doesn't allow me to. If you have very high mental stress or your training load very high, this will also cause you to injure your knee easily.
Yeah. I think also muscle stiffness and everything also will affect lah.
Yeah, definitely a lot of things will affect. So we need to tackle those issues one by one. So if you have hip weakness, definitely we have to improve your hip muscle strength. So if you have a very stiff landing, means your knee control is not good enough. Definitely we have to give you exercises which can help you to do a proper landing to avoid the injury. So if your posture means form. So for example, if you do lunges, your knee actually is not having a good alignment, then you will also injure your knee easily. So when you do your movement and all these sort of things, we will actually check whether your alignment is proper or not, whether when you lunge that time you are lunging correctly or not. So these are the things that are very important as well. And also when you jump, some people, they don't know how to jump. When they land from jumping, their knee actually go inwards like that. So with very bad posture, definitely there's an increased chance of injury as well.
Yeah.
Age is also a factor, definitely. If you are like 50, 60-year-old, you still want to do intensive sports, definitely you need to have extraordinary muscle strength so that you can protect your knee from getting the injury again. And sex here is not that sex, it means a gender, male and female. So definitely female are more vulnerable, like definitely the world is not fair. So female, if you have ACL injury or you haven't had an ACL injury before, you need to pay extra attention to your muscle strength to avoid further injury to your knee, because structurally our knee is more vulnerable to injuries, definitely. Why do I say that? Because usually for female, our hips are wider, so which means our knees will tend to go inward like that.
Wait, this one like Japanese or? I see a lot of Japanese do like that because I think they sit, they don't really sit on chairs lah, like they bend, they squat.
They do a lot of Japanese kneeling. Yeah. And also you see female tend to walk with their knees turning inwards also as well. They'll go in a lot more like that compared to males. More 温柔. Yeah, more gentle lah, more ladylike like that. So females usually won't walk with the leg kangkang one lah. So but with this type of problems, we tend to injure our knee more easily, especially for female athletes. So if the sport requires you to jump a lot, to run a lot, but you are having this structural problem, then you really need to strengthen your muscles properly. Otherwise, there will be 2 times risk of knee pain compared to guys, and a 15 times risk of future ACL injury, much higher than males, than guys. So if your patient is a female client, then definitely you need to let them know what is the risk.
15 times risk of future ACL.
Yeah, 15 times higher than males. So according to this graph, you can see this is what dynamic valgus means, because in my previous chart, dynamic valgus is one of the factors that will cause you to injure your ACL again. So dynamic valgus is this. So the knee will actually collapse inwards. And why it happens? Usually because your hip muscles are weak. Or you are female and you tend to have knock knees. So dynamic valgus will tend to happen. And if you have dynamic valgus, you will tear your ACL again easily. or you have a high risk of injuring your ACL ligament?
I think mine is like that. I think.
Probably when you do lunges that time, your knee go inwards
A
because
bit.
you didn't strengthen your hip muscle properly. And there are also a lot of other things to consider. I will not go into detail, but this is a chart that mentioned that type of sport is very important, and what type of athletes you are. Whether you are just a normal weekend warrior, you want to play badminton on Saturday, Sunday only, or if you are a competitive badminton player that plays badminton every day, is also something you need to consider about. So another thing that you need to consider also is your fear of getting the injury again. So we keep on saying this over and over again. Mentally, it's very important to get the confidence back. Otherwise, when you go back to sports, definitely you won't feel comfortable playing it.
Yeah.
And how much you are willing to go back to sports is also very important. For example, you think that this sports is too dangerous for you, like some people wants to actually to go back to skiing, and you are not confident that you are able to go back to skiing, then if your personal choice is not to play the sports, then better not play it lah. You have to also listen to your body sometimes and listen to your mind. Then maybe you can choose other safer sports to do rather than just going all out for more dangerous sports like skiing.
Yeah.
So the last but not least, prevention of second ACL injury is to strengthen your hamstrings.
Hamstring really important, right?
Yeah, very
The
important.
main.
Because maybe I can show you this graph first. So this is your hamstring.
Okay.
And this is your quads. And this is your ACL. So you can see that the ACL actually prevents your bone here from going to the front. This is the function of the ACL. So hamstring actually helps to pull the bone backwards, the other direction. So for example, if you are running, then you suddenly stop. Then if your ACL not strong or your hamstring not strong, your bone actually will go forward, then you will tear your ACL. So if your hamstring is strong enough, you will actually hold the bone here. The bone will not go forward and tear your ACL. That's why it's very important to strengthen your hamstrings after the surgery.
Now I understand.
Yeah,
This
hopefully
one
everyone
very-
understands. And then other things to do to prevent second ACL injury is to prevent muscle wasting of the operated leg. Muscle wasting means your muscle actually becomes smaller after the surgery. Another question here,
Really becomes
would
smaller.
you all strengthen hamstring with concentric or eccentric method? Both. Definitely we will do both. And the eccentric part is actually very important as well, especially if your sports requires more eccentric strength. Definitely we have to look into both concentric or eccentric. So for those people who didn't know, concentric means strengthening of the muscle in the shortened position. So like for example, you go to the machine there, you do the leg curl. So that one is a concentric method. So eccentric method means you are strengthening the muscle where the muscle is lengthening. So sometimes you do Nordic curls. So maybe you can go and search up this exercise, Nordic curls. Not everyone can do it, but definitely it's very effective to maintain your hamstring muscle strength even though your hamstring is lengthened. So basically the exercise involves you leaning forward, and then your leg is actually sort of being hooked onto somewhere, and then you lean forward, and then your hamstring has to hold you in place, will not prevent, to not let you fall down like that. So it's a very interesting exercise, the Nordic curl. Because we must prevent injuries in all kinds of situation, in concentric or eccentric phase. So definitely you need to look into both. And sufficient muscle strength to meet activities demand. So definitely you have to do the proper strengthening, and then you need to do tests to see whether your muscle meets the ideal strength or not. So when you talk about muscle strength, we will talk about your quadriceps, your hamstring, your hip muscle, your core, your calf, your shin, buttocks, yes, everything. Basically it's everything. And also you need to meet your return to sports criteria, which we have talked about before that. Before going back to the sport, you need to pass the test. And then again, we need to test your psychological part to see whether you are confident enough or not. If you are not confident enough, then probably forget about it.
Don't know.
Yeah. And lastly, a good fitness level to meet the sports demand. Actually, back to certain questions, right? Actually, the latest research mentioned that eccentric method of strengthening the hamstring is actually more relatable and more applicable as well to prevent injury of the ACL. So definitely you need to focus a bit more on the eccentric and not just the concentric method. So if you talk about strengthening of the hamstring, to what extent you need to strengthen your hamstring? Some people will say, oh, my hamstring very strong, I think because it looks very bulky. But you need to have a certain measurement. So the popular belief is that you need to have at least 2/3 strength of your quadriceps. So let's say your quads, your muscle over here is, for example, 6 lah. Then you need to have at least 4 for your hamstrings. At least 2/3.
But
So
sometimes very bulky but not activate also.
Yeah, no use.
Right?
Yeah, that one is a useless muscle. So you need to have really the activation and the proper power and strength for it. So 2/3 is the popular belief, but actually you need to have more, especially for athletes. For normal people, maybe 2/3 is fine, but for like Juan Shen like that, you probably need 80%. So your hamstring strength needs to be 80% of your quads. If your quads can push 100 kg, then your hamstring need to push 80 kg.
Oh, okay.
Of course, the best will be even more than that lah. Which is very hard to achieve for some people. Sorry?
If the ratio is same, that means
Okay, it's even better. But most of the people most of the normal people that I see in my center, the hamstring is not even 1/3 of their quads. Not even 1/3. Because didn't really forget to strengthen about hamstring. Usually they go to the gym, they like to do the leg extension machine, they like to strengthen their quads, but they forget about the hamstrings because it's at the back, you cannot see. Okay, so hope everyone understand this. So female athletes, since they are more likely to have ACL injuries, should do their best to increase the hamstring strength and to improve the hamstring and quadriceps ratios. So like what I mentioned just now, female really have a higher chance of injuring their ACL. So since hamstring is the muscle to protect your ACL, then you need to further strengthen your hamstrings more.
Focus more on.
Okay, so now comes to the Q&A question for you.
Yeah.
So actually there are a few questions like what is the first thing that came into your mind when you injured your knee?
First thing is that hopefully don't kena my ACL lah, and then was really didn't know what to do lah. Want to operate or don't want to operate because I'm an athlete ma. Then didn't know what to do. Then went to few doctors, and then the final result also total tear. Okay, then really got no choice, and then just see what to do after ACL, after surgery, then step by step, then after few months, then I feel really not that bad lah. I mean, recovery time also maybe 4 to 6 months. Then after I can walk everything, then I feel luckily I did the surgery lah. Yeah.
Because I think you probably feel that if you do the surgery, then you won't be able to play badminton again, right?
Yeah.
Especially
actually, not only for athletes lah. Actually, for normal people, my friends also, they didn't know want to go. They didn't know they want to go for surgery or not. Yeah.
Yeah.
Maybe sometimes it's also age problem lah. Sometimes when you're old, you are scared of surgery as well. Yeah.
That's why the point of today's session is to let people know that if you do your things properly, you follow the steps after the surgery, it's possible for everyone to go back to sports or go back to the things they want to do after the surgery. So because people sometimes they are not aware what they should do, like what you say, don't know what to do after the surgery, how to go back to sports. They are not well aware of it. That's why they are a bit scared. So once you actually know what are the proper things to be done, then you won't be scared anymore. It's actually a very good chance that you are able to go back to sports safely.
Yeah.
Like,
And
like
then
now,
more,
I think that,
actually, kena already, you are more aware lah of building your muscle, and everything lah.
yeah, like the Carolina Marin also did her
Yeah.
ACL surgery not long ago. Then I
Yeah,
see her
first,
recovery
second
progress.
time.
Oh, but her recovery progress is very fast, and then she really do her exercises properly. So I'm sure she'll be back in competition in no time.
Hers very, very, very fast. Oh. I think
Yeah.
after 6 months already champion. 3
Yeah.
champions. Yeah.
Yes. So this is a good example.
Mm.
So actually, after your surgery in October, how long does it take for you to go back to badminton training?
I think 4 months. After 4 months, I did some normal exercises, and then like normal, not intense training lah. Yeah, started off court
Slowly.
training slowly, and then I think 6 months after 5 months lah. Then I started playing some, but didn't really have much confidence lah, because that time I didn't really do properly on my rehab lah. Yeah.
And during your recovery, you got face any issues, any problems, anything that happened?
I thought I was ready to go back on court, but actually not really 100% yet. Then that day I was training, then suddenly like kena my leg lah. So I was really scared lah. Then I went to Dismart and everything. So now I feel more confident lah, because got training ma. Yeah.
I think what happened at the time.
I think you must really like what you said, pass the test first lah, before you.
Yeah, I think that time you twisted your knee, so there's a bit of swelling after that, but now managed to improve your condition already. Yeah, so definitely there will be some hiccups also lah. Sometimes there will be some setbacks during your recovery. So most importantly, you have the right person or the right place to go to sort out the problem. You cannot just let the problem be there only, otherwise it will become worse and worse. So this one, I think I know your answer, but mental or physical, which is more difficult to overcome?
Just mentioned just now, right? I
So
think mentally really important lah. See, you must be positive lah. After your surgery, you must really feel that you can go back to sports, can get back to sports. Yeah, because some of them, because I think also people will say, wow, very hard after your ACL surgery and everything. Yeah, but I think it's okay. It's okay.
Yeah, definitely. Okay, so this is just a video that we took recently of you doing the rehabilitation at our center. So of course, speed is very important if you want to go back to certain sports. So this is an example of reaction training. So you train back your speed when playing some badminton drills.
Very tired this one. Oh, you.
Yeah. A lot of people also complain that this is like the most tiring part because they need to
get Jared to go through this one. Jared, see you.
Yeah,
at first I did this was really very tired lah. Then I think after maybe 4-5 sessions, maybe I get back my muscle and everything. Yeah, so now better, a lot better.
Yeah. Malaysia can beat Japan tonight or not?
Yeah, no problem.
Sudah tentu.
Sudah tentu. Tentu apa?
We go sembahyang first afterwards.
Ayo, torture chamber.
But hopefully Malaysia can have some surprising results lah.
Yeah.
Today one was very
intense. 9 p.m. Yesterday also it was a upset already.
Yeah. Torture by happy lah, I think, because the more you do it, the more you're confident towards your sport. So definitely it's a good torture chamber. Okay, the main hero of the day, Dr. Gan Eng Cheng. So he's our consultant orthopedic and sports medicine surgeon. So now he will be giving us the latest updates on ACL reconstruction method. So please welcome Dr. Gan.
Hi, everybody. Again, thank you for joining us. Right, we're going to do this short and sweet. Before that, I need to tell you why we have this smart. Right, we have this smart 9 years ago. I've been orthopedic for almost 30 years. So my work was just to cut but I don't know what happened to patients after that. To be honest with you, that was a feeling. Then come a day that I say, hey, hello, we have to see whether our patients are going back to sports or not, whether they are okay or not okay, and so on. That's the reason for forming this smart. And to enhance this, I went to actually take my master's 2 years later. So when I was 50, I took the master's in sports medicine because I need to know, not only treat them, not only potong. We need to, after potong, to make sure they have the muscle, they have the knowledge, and also doctors have the knowledge to impart upon them so that they can go back to games again. So my thesis actually involved looking at patients who go back to sports again after ACL. So we compared 3 groups. One is before I did my master's. Then after that, after did my master's, and we compared with some national athletes because I actually see some national athletes. So those national athletes, almost like 80-90% of them go back to sports again within 9 months. So then we look at the earlier surgery, 20%, only about 2 or 10 to 20% only go back to sports again. So then they have to be smart. So we were dealing with them, everything. So we are proud to say that we are almost like as good as ISN in putting back them to games again. Right. So that is what we are proud of now. So actually now we have the sports lab. So sometimes to tell you the truth, ISN pinjam the use of our sports lab, look at the assessment and see whether the sportsmen are okay or not. Right, especially those cases that I'm referred to for further treatment. So they have to go through the meals, they have to go and test and all these things. So Sumpin, they also use our function, right? So never mind. National service, we call it. And then we open our doors to indie players as well. So those people like a lot of badminton players. So all those, we welcome all the independent players who wants to have treatment here. So we are giving them free treatment. Right. So currently we are actually looking into a few things. We are looking into a bit of local, international as well. We are treating some people from Namibia, the national footballers who are playing with Terengganu. Indonesia, we are getting one who is we are treating him now for injuries that he's playing with Sabah now, right? So we're going international. This one, okay.
Yeah, a lot of footballers.
Okay, the problem with ACL is that just now we mentioned that the importance of hamstring, right? Traditionally, we take it from bone patella bone. Then we have an issue. Bone patella bone is the front of the bone here. So we take the graph here and then we tambah and tanam balik the ACL. So basically ACL gone. ACL cannot be repaired, right? So we have to take from somewhere and tanam it back. So traditionally we take the bone here, we take the tendon here, and we take the bone here. What we find is a lot of people like badminton players, if you go lunging and all this, you have a lot of pain. And the Muslim will have problem prayer. Right, so there's a lot of problem. Then the cartilage, the mount tracking will be there, right? So we decided, right, then many years ago to take hamstring. But when you take hamstring, there's an issue as well, right? Because the hamstring is very important for ACL protection. So now we are always thinking of how else to improve this. So we actually went to quadriceps, also disrupt the muscles at the top here. So the latest now is a hybrid style treatment. So that means we use artificial ligament, right, with little bit of hamstring, right? So the injury to the hamstring is not that much, all right, or the weakness that we create by taking from somewhere and replace the ACL with it, right? So we actually hybrid it so that the ACL become a good size, right, and it's very strong. The idea, we use Artilon. Artilon is the ligament, the artificial ligament that I have been looking at since 1992. It took us almost 20 over years to have the courage to use that. That also give enough time for us to see the result. Currently, this ligament is being used in Italy a lot, right? Where they use it for their AC Milan players, their Inter Milan players, or their soccer players. So we see the result is good. Then only we start using for the past 3 years, close to 3 years now. So we have a series of almost like close to 200 cases now of different operations. So what I'm going to go through is how we do the ACL, the new method nowadays. Okay, so we have the video now.
Yeah.
All right.
My poor hamstring has never really been the same since.
Yeah, that's the issue, right? The hamstring is the issue. This is a picture of what happened to your ACL when you rupture it. You can see that this is the whole thing here. There's supposed to be an ACL here across here. So this is what is left of your ACL. The stump, we call it. The whole thing like, it's gone like that. So, or else it become like a whole thing like that. So now it's like that. So you can imagine this one, if we were to move on it, you would be very unstable, right? So we also have to look at the meniscus. Thankfully, this guy, the meniscus is okay, but certain areas when we look at the meniscus, it is not okay when we pull it out, right? So JS, don't know whether this is your meniscus or not that they repair, because they need to check properly when we see the meniscus, right? So we need to prepare. This is a special instrument that you use to prepare the ACL. It's called the radio frequency ablation. And this is a burr. So we have to prepare the base for it and look for where the ACL comes from. Previously, we always have a guide. Now we look at anatomy. That means where the ACL comes from, right? So we normally put it back to where it is. This is a video on how we prepare the ACL, right? So if you can see that I'm stitching there now, right? We harvest the thing. Then maybe later we will show you how we harvest the thing. So that's a bit bloody. So we keep it later for you to accept this one first. So you can see that now we also prepare the graph. There are two graphs here. One is the ACL, then one is the Artilon, the artificial. We may not be able to see very clearly now, but I think if you later, the more zoom in picture will show you very well. This is to see when we prepare it, right? How we prepare it is like preparing spaghetti like this. Okay, so now we have to size it. We have to see what size according to, so you are big size, we have to use a very big one. And then if you are small size, we have to be adequate and all this one. We don't want to overstuff your knee, because overstuff can create problem. Then you cannot straighten your legs and so on, right? So if we look at that, this is to prepare the tunnel. So when we plant something, because it's arthroscopically or small hole surgery, right? So we create holes, a tunnel where we can pass the ligament through. That was the tibia, the lower bone, right? Which is this bone here. So then we go up to the upper bone now. If you can see this one here, we are using special equipment. We don't look, we are from outside, we are looking at the video. What you see is what I see as well, right? When we operation. So we drill, we get a guide to guide us where it is, right? So you can see actually the stump of the ACL just now, where it comes from, where it was. Right, so we create a guide. Then after that, then we enlarge the hole and become a tunnel. Like you see the MRT, they make a hole there. This is what we are doing now. So you are after the procedure, you are very holy. A lot of holes. Right, so we are creating now 2 tunnels, one in each bone. So what we want to do is bridge the two bone with the ACL. Right, so you can see the outside there on the floor there, quite bloody, a bit lah, right? So this is to drill the tunnel. So the tunnel, the size of the tunnel and so on will according to the patients, right? And the depth of the tunnel, so we have to be very precise. Okay, this one will show you how we harvest, right? How we take the hamstring. So we try to be as gentle as possible, being orthopedic surgeon, right? So we will take, instead of 2 last time, right? We will take only 1 now, right? We take the smaller one, so that it will give you less effect on your hamstring, right? So that's why we have this special instrument called the harvester, the tendon harvester. You can see that as you pull out, that's what we get. It looks like exactly like spaghetti. You see, this is exactly what we are preparing now. So this is your own ligament. So I have to stitch the end so that I can hold it on both ends. Right, I'm quite sure there's a lot of questions after this. You can see there are 2 things here, right? One, the white color one is the artificial ligament. So we're going to kawinkan that too, so it become a hybrid, right?
Oh.
So that I don't have to take 2 from you, so that your hamstring is still preserved. So then I have to size it accordingly. So I have to see the size. So for Jensen, your size probably is 8 or a 9 like that. A 9 lah, better. Right, so that's why see my nurse had to help me to do this surgery for me. Okay, this is a guide, right? We use a guide. You can see from inside and outside now, even better view, right? So after creating that 2 tunnel, right? Then after that, we will clean up the area. So then after that, we will try to enlarge the hole according to the size of the graft, right? So there's a few procedures to do lah. So when we started doing this procedure, it's almost like 5 hours. Now we are doing it about an hour or an hour 15 minutes like that. So you see that we are putting in the ACL graft now. One is the outside. You see the inside. We are pulling through the ACL graft, going inside, go through. There's a special button that can lock at the top, right? I put it purple because then we'll know where we are, right? So it's locked at the top because the button locked at the top already. Now the bottom. This is what we see now. Yummy. So the purple indicates that this is the ACL that we have put it in, right? Isabel.
Kind of weird
Annabelle. Oh, okay.
to see the knee P.
Oh, the knee P. Okay. So that is exactly what we do. So all this process of cleaning up, creating 2 tunnels, one in the leg bone, one in the thigh bone, and all these things, then passing through the graft and all these things. And this technique is we trying to. Last time we used to do big cuts, and then after that opens your knee, and then it become very. Last time the rehabilitation we put you in a cast for 3 months, and then you now can walk at 6 weeks without crutches, everything. Yeah. So now the ACL surgery is actually very fast, very good, and all these things. So then you can immediately start rehab. In fact, you should start rehab the day after the surgery. You can actually walk without having to be put in cast. So one more surgery that we now looking into is the ALL. So we find that the rotational movement is an issue for players. Because you are not just moving forwards. It's not this movement that I'm talking about. You're also talking about this movement, twisting, turning movement when you land. So using the Athlon or the artificial ligament, we can actually prevent the rotational movement by doing ALL, the side ligament. So that is to prevent rotational movement for patients who are athletes, who are high performance, who are previous surgery before the second surgery. This is what we need to do. We need to strengthen the area. That is the Athlon, the artificial ligament. It looks like a shoelace,
Oh.
A shoelace, right? But the material will stay there for 4 years, right? The strength will maintain for 4 years, right? So in a way, you are already using a brace. So you see all my patients without a brace because we use this. You already have a brace inside. Why do you wear a brace outside? That will make Joey's work more difficult because she has to build your muscle even more then, right? So the preparation for the ALL is the same. So we still have to get the appropriate size. We have to stitch the side. Then after that, then we have to measure the size, right? Then after that, ligament. This ALL ligament, anterolateral ligament, is actually a forgotten ligament that they found in 1895. So then they think that it's not important. So now lately for the year 2010 or 2015 onwards, it become a very more important ligament asset, especially for those failures. So you saw that just now 25% failure. So this is one that we are trying to avoid the 25% and bring it down to as low as possible.
Okay.
Right. So this is what we are looking at now. There's new thing coming up. There's stem cell coming out, artificial ligament coming up. There are more and more things coming up. Right.
Dr. Gan very pro. Yeah.
Pasti.
So we are looking into more and more things now. We are looking into in future. What is the future for ACL? Future for ACL, if you have a partial ACL ligament, you look at the drones that they do for Mooncake Festival. If you imagine that drone is in the micro thing, I can tag it. I can say that, okay, hello, you drone, go there, go to the ACL and repair it. That's what we are looking at in future. So for me, to all of you who have a knee injury, please keep your knee original. Don't change it into a metal knee. Then we cannot use the special treatment next time to treat your knee. Right? Keep your knee original. Go and see Joey. Get your knee to be strong and then keep it okay. Maybe not in my lifetime, but in your lifetime. Right? So you guys here, so that by the time you're 50, right? Gerald, you're included, is it?
Yes. It integrates after 4 years, no?
So integrate immediately, right? After about 6 months to 9 months, it's already integrated already. So what it do is stability is there for 4 years, right? That's the beauty about this one. So that's why we were looking into this material. Before that, you know what they were using for artificial ligament? They are using things like Gore-Tex. Gore-Tex is the material you use for your shoe. So in the 1980s, late 1980s, 90s, it failed badly. So that's why we were so scared to use all these artificial ligament until things like this come out.
I mean, disappear, dissolve. No?
It dissolved after 4 years.
Oh.
4 years, Jared.
That shoelace will dissolve after 4 years.
Yeah, you will keep there for a long time. That's the thing. That's the beauty of it. At 4 years, it's just like Mission Impossible. Yeah. Right. So that's a new thing now. So please keep your knee original. Right. ACL surgery is not going to be what we are looking at now. ACL surgery is going to be done from a computer and then probably a syringe, right? A fill-up syringe with special drones and so on, micro drones or organic drones or whatever that can disintegrate, inject into your knee and can listen to our instruction and go and repair it and then put whatever that is inside there. So we are looking into that, right? There already people are looking into that, but it is still very early. So we are also looking into applying stem cells according to where it is, let it grow and all these things. I'm quite sure you hear of a lot of those things, but they are not good yet. So don't listen to anybody who says that they are, I can treat you 100% with stem cells. Those are not true, right? So what we need to do is now wait and keep your knee original, exercise, keep your weight, don't injure yourself too much, right?
Go to D-Smart, yeah.
Go to D-Smart, yes. Okay, question time.
Yeah. So if you are interested in what Dr. Gan is doing for his patients, what are the surgery and or you want to have more insights of his procedure and surgery, you can follow Dr. Gan Eng Cheng on his Instagram and Facebook. So seldom you have an orthopedic surgeon who have social media one. So this is your good chance to follow Dr. Gan on social media and get to know more about the surgical procedures. So now will be the Q&A time. So feel free to drop any comments on any other questions that you want to ask about physio, rehab, surgery, or badminton, or how to become a badminton player. So you can ask anything you want to ask. So while putting in the comment for questions, we also have a lucky draw event. So if you want to participate in the lucky draw event, you can actually comment this quote here: smart way to health and fitness in the comment section. So after the session, we will select 3 lucky people to actually get a 20% treatment discount voucher. So we will message you if you are one of our lucky winners. But in order to participate in this lucky draw event, you need to comment smart way to health and fitness. So immediately you will get the treatment discount voucher if you are selected. Smart way only. So yeah, and we are also open. So our Q&A session will be only about 10 to 15 minutes. So please take the opportunity to ask any questions.
Yeah, Cepat. Dr. Gan,
Yes.
ACL surgery is minor surgery or major?
Oh, it's a major surgery. We make it look like it's minor, but actually it's a major surgery.
Oh,
But
okay.
because it was a very dreaded surgery last time because we had to open up so many incisions. Now because of arthroscopy and then because of the advances, it makes it very simple now. Right. Actually, where I was trained, if you see the recent report, there was a Professor Freddy Fu. He was my sifu.
Oh, okay.
He just passed away. We learned from him, right? His center, actually now he operate and then the patient actually go back immediately after that. Within 3 to 6 hours, they go home. They don't even stay in the hospital anymore. Right. So that's the level of care that they are looking at into ACL now. So you start your rehab actually almost immediately. You move, right? Some of them don't even want to use crutches and walk, but those are very strong muscles, patients, and so on.
So we have a question here by LWY. Want to ask, is the meniscus tear at the same time my ACL tear, or it is because of continuous physical activities after the injury?
Yeah, most of the injury, so meniscus is a cushion. So when your meniscus, your ACL give way, so it causes a rotational shearing force, and that will tear the meniscus. Right. So then, if you do not tear your meniscus at that time, you tear your ACL. Right. We know that over time, because of the instability that's created, you can also tear your ACL with time. So you cannot run away. So it always be a consequences. The meniscus tear is one thing, but the cartilage injury after that consequences is the more worried, because that will cause osteoarthritis. Right. So that's why some of it, if your meniscus is injured, right, and it is locked, so it is for us, it's a surgical emergency for us to go in and do something for you as soon as possible.
Yeah, I think also LWY asked that is meniscus tear during the time where you injure your ACL, or is after the injury? I think it can be both. It can be both. So it's either when you injure your ACL at the time due to the twisting motion, then you also injured your meniscus injury, or it might be also because after your ACL injury, your knee is less stable, then you will be gradually injuring your meniscus as well. So these two situations can happen. But most of the times when you injure your ACL, you will also injure your meniscus lah.
Okay.
Yeah. Another comment here, Jared, on crutches are great. I got wheeled through the airports in KL and BKK like a VIP.
Oh,
no need to queue like a normal people. Yeah, you do get special treatment lah. If you are using crutches, people also will let you sit down in the MRT.
Jared, you come to my clinic with crutches, you still have to wait, huh?
Yeah, definitely.
No special treatment.
If you want to see Dr. Gan, you have to wait, definitely. Another question from Nisa Fatini. Hi, Dr. Gan. If ACL with hamstring graft, when is the best time to start strengthening the hamstring?
If you have an ACL injury, if you have the time before the surgery, please strengthen your hamstring. Pre-op strengthening is much better, right? Because before the surgery, you can actually push your hamstring even more. So then you will cut down the time of your initial recovery. That means your crutches, your swelling, your muscle building, and so on. So that also cut down the headache for a lot of physiotherapists as well. So if you have a hamstring injury, if you have an ACL after that, you should also start hamstring strengthening almost immediately as well.
Yep. Another question here. Okay, in order to strengthen your hamstring after the surgery, sorry, I just want to add some points for Nisa Fatini's question. Usually, we will start with active movement first. So, for example, you ask the patient to bend the knee to activate the hamstring first. So, once the surgery is more stable, slowly we'll introduce some weights, some resistance. Then we only can start to do resisted training for the hamstring. So, it cannot be like one shot, otherwise you will pop your hamstring. some patient after the surgery, they will actually pop their hamstring, means they will cause a micro trauma to the hamstring, and then you will have bruises.
Harvested, man.
Yes. So you need to be careful lah. You need to be under the hands of professional people to introduce you the proper hamstring strengthening exercise. So you cannot straight away simply do any hamstring exercise after the surgery. If you are using hamstring graft, so please remember that. Okay. Another question from Natalie Singh. Can a partial tear ACL heal by itself through rehab process?
Okay, ACL is a ligament under tension. So we are actually looking into how to heal a partial ACL injury. So that's why the work on stem cell is where we are focusing on. So the ACL, whether we can put stem cell inside there or not, but the problem is we can't focus the stem cell to that area alone. That's why I said about the drone technology will come in next time. If you have a small ACL injury or partial ACL injury, can we tag the drone with the healing stem cells and then go on to the partial tear and also heal it on the spot, like that. So we relay a bridge for the stem cell to go there and heal itself. By itself, the ACL will form a scar tissue. It will not heal back to ACL alone.
Yeah, due to the nature of the ligament where it's not so vascularized, normally healing to its original state is not so possible. Scar tissue will be formed. Scar tissue are normally weaker, much weaker than the original tissues. Yeah, scar tissue is not your real tendon, your real muscle, so definitely it won't be as strong as before. So again, if you are considering whether to opt for surgery or not, again, you need to ask yourself a few things. Are you going back to sports? Are you putting yourself in the risk of injuring your ACL again by doing sports such as badminton, skiing, football? If yes, then probably surgery is still a better option because you are still going to expose yourself to those twisting movement, left-right movement.
Yeah.
So, okay, another question by Mashita Said. Hi, Dr. Gan. I have few nurses friends who have problem with their ACL. Do walking too much or stand too long contribute to ACL injury?
No, you need to walk 10,000 steps a day to maintain your body weight and then also your health, everything. Walking alone is not a problem, right? When you're walking on uneven ground, if you have an ACL, may be a problem. But walking alone will never cause ACL injuries, right? You have to twist your knee to have that. So on uneven ground, please be careful, right? Slippery ground and all these things. That's why it's very important to maintain your muscles, maintain your weight, maintain your health, right? Make sure you keep yourself rested and ready to move all the time, right? So you need to exercise regularly.
Yeah.
Then Dr. Gan, with your experience of working with nurses, why do you think all the nurses got ACL injury?
Maybe I stress them too much, I think. Well, they kind of like have ACL injury, but none of them see me. They are so worried that I will operate on them. But I think the current nurses are overworked, right? So I think you all need to spend some time outside of the operating theater or outside the hospital to go and strengthen yourself, go to the gym and so on. I think that's the main reason for you. You're overworked. You need to be paid more.
Yeah, probably stress and also sometimes weight. If you're overweight, then of course you will tend to have this type of injury. Then muscles too weak. Then these are the risk factor for ACL injury. Another questions. Hi, Dr. Gan. If wearing knee brace after ACL, when is the best time or specific goals to wean off the brace?
Well, I don't use brace, right, since 2005, right? What happened is that the patient always come to my clinic with the brace in the hand, never on the knee, right? So then they complain, gatal lah, tak boleh pakai lah, susah lah, and all these things. So that's why since then, I have better result without brace. To be honest with you, you activate your muscle faster, you move faster, you unrestricted, and so on. You are more careful there's less injury for patient without a brace than a brace. And not only that, if you wear a brace for long term, right, you're going to shrink your muscles, right, because your muscles tend to be lazy and not using it, right? So for your question, I don't use brace anymore.
Our patients here never
Quite
use
long.
only crutches for a few weeks after the surgery to prevent you from walking too much, to share the load of the knee. That's it. I think brace is limiting your knee movement.
Yeah, there are certain conditions they actually use brace, not ACL. MCL for that matter, if you have a grade 3 MCL, you use that. So or with any certain type of fractures that you have, you want to limit the movement there, you use brace. But not ACL injuries and ACL reconstruction, hardly used already nowadays.
Yeah. Because I think it limits the movement and cause some unwanted stiffness in your knee as well. Because our goal is to promote movement in your knee, to make you enable to bend and straighten the knee properly. So I think brace is doing the opposite thing lah in ACL reconstruction surgery cases. Okay, any more questions? If not, we are going to wrap this up. Thank you for the comments. So we will announce the winners by today itself. We will actually do a lucky draw random picking of the winner, and then we will announce it on our Facebook and Instagram, our social media. So make sure to follow us so that you know that you are the winner. And we have quite a number of comments already. So thank you very much. Thank you. So any last words?
Thank you very much, right? Keep your knee original, right? So don't injure your knee too much, right? Keep your weight, keep your muscles, hamstring especially.
Yeah. So if they are and don't have any more questions, then we shall wrap this webinars already. So thank you for joining us in our DSmart first ever webinar. So hopefully everyone will learn something through this session. It's our first time, so there might be some hiccups here and there. But overall, I really do hope everyone learns something. And I would like to personally thank Lao Shen for being here with me.
Thank you. Yeah.
Okay, thank you, man.
Thank you, Dr. Gan. Thank you, Joey.
Yeah,
thank you.
Thank you for sharing your very valuable experiences as well. More, please. Yes. Okay. Before we end the video, we would like to announce that there will be another webinar in the future as well. This time it will be about back injury. It will be about everything you need to know about slip disc and how to do weight training properly. Because recently there are many gym goers that injured themselves while lifting weights and slip their disc. So this condition is commonly known as slip disc. So we will actually share on how to prevent that from happening and also the proper weightlifting techniques. So follow our social media, DSmart Center on Instagram, Facebook, and this is our website. So follow us to get some more updates about our webinars. So thank you, everyone.
Thank you, Joey. See you.
Thank you very much. Bye-bye.
Bye-bye. Thank you, Dr. Gan. Bye-bye.
Bye.
Thank you. Thank you. Bye.
Okay.